wear some sort of face covering that might be something that is homemade. When we're talking about our long-term care or nursing settings or healthcare settings, we're talking about health face masks that are approved by the FDA and have some certain components to them that are appropriate for them, but they are not N95s. I'll let Director Sprayberry talk about the FEMA issue.
Thank you for that question. And so you're talking about the Emergency Non-Congregate Care Program. And the way that we anticipate that's going to be implemented is that North Carolina Emergency Management, working very closely with the Department of Health and Human Services, would also assist our local partners at the local health departments and their local emergency managers to operate this program. And we would assist them as they put people in hotels and dormitories, and it would be how they would keep them apart. And I think that folks that would be going into these places would have a vested interest in keeping separate. And so they at the local level would be managing that, and we would be providing assistance. Thank you.
We thank you for being with us today, and we also want to close by thanking all of the people, as Dr. Cohen and Mike have said, thanking all of the people who work at our long-term care facilities and our nursing homes. I've always thought that even under the best of circumstances, that they were doing the Lord's work, and it is so much harder now as we face this pandemic. We're grateful for their good work, and I know that this team, we're going to do all that we can to try to protect you and your patients. And thank you for being with us, and we'll probably talk to you tomorrow. Thank you.
Good afternoon. My name is Jeremy Collins, and I have the pleasure of serving as the Engagement Director for the 75th Governor of the State of North Carolina, Governor Roy Cooper. On behalf of Governor Cooper, Cooper administration, cabinet, staff, and state employees, I want to thank each and every one of you for being with us this afternoon via WebEx, YouTube, teleconference, and any of our other social media streaming devices. Welcome to each of you this afternoon as we try to provide some critical information to our faith, nonprofit, and small business communities. It's difficult as we're spending so much time preparing and being proactive and responding to this difficult crisis to remember to be thankful. We have a lot to be thankful for in the face of so much devastation, so much uncertainty. Brave men and women, young people are risking their lives to help others. We have two people in our office who this week have lost loved ones to this crisis, and our hearts and our prayers and our thoughts go out to them and their families. And so even as we are working to try to build a stronger, safer, healthier North Carolina, we're yet grieving with our team members and their families and our loved ones. So we send our sincere prayers and thoughts of healing and comfort to people all over North Carolina. On behalf of Governor Cooper, we're excited to be in our fourth session to bring you information, resource information this week that not only can help you stay safe and healthy from the COVID crisis, but can also help you begin to recover. I want to first thank all the healthcare workers and frontline folks who are out there today, right now, as we're talking, risking their lives to flatten the curve and to slow the spread. I want to thank Governor Cooper's cabinet, agency staff, and state employees for all the work that you're doing to keep this state moving, but also to protect our state employees and to protect the people who we have been entrusted to lead. The aggressive nature of this COVID virus has caused us to do some things and compelled us to take measures that sometimes have real consequences for people. We want you to be able to gather for worship, but we also know that gathering makes you more susceptible and vulnerable. We want your businesses to thrive, and we want you to realize all that your commerce can happen, but at the same time, we know that the best way to protect your business is to protect your customers. And so we carry that with us every day as we're thinking about what to do and how to move. And Governor Cooper, along with staff and cabinet, are constantly talking about how do we keep people safe and at the same time make sure that we don't trample our culture and the spirit of who we are. Governor Cooper's put in place a number of executive orders and directives that save lives and limit the spread. Closing schools, limiting restaurants, takeout service only, and closing non-essential businesses. All of that is hard. We know it's hard. It's tough. For some folks, it's even tougher. For some folks, it's not just difficult. For some folks, it's devastating. We understand that. And you're not alone. We don't want you to feel like you're alone. We know that getting through to DES has been difficult because of the overwhelming overload of folks that are trying to access unemployment insurance benefits. We know that getting into our Health and Human Service portals at sometimes has been difficult to leave messages, or even our governor's website has been overloaded. We want you to know that we're working every day to expand our access, to expand our reach, such that no person goes unserved. This is something that is changing the way we do business, and we're trying to make it change the way we do business in the best way possible. We've had to make some difficult choices for our families, for our business, and for our economy. We're working around the clock to thoughtfully implement policies that keep us safe and allow us to do the things that we love. We're doing everything we can right now to get needed supplies and equipment for our hospitals and first responders. It's critical for us to talk to our faith and nonprofit communities this week, as many of us are observing Holy Week. We want to remind you that although our longstanding traditions might be to gather and to fellowship over this weekend for just and great cause, now is not the time for us to do that. We have to be reminded that our connection does not have to necessarily be physical. And you'll be hearing more about that later, but we're urging you to maintain the social distancing, to make sure that you are being a good neighbor. And what that means for right now is not necessarily being in the same place with your neighbors. As hard as it is to do this, this is going to have to be an act of love for us for the next short while. This pandemic isn't going anywhere anytime soon, and we intend to be here to continue to give you the information that you need and help you see it through. Dr. King said nearly 52 years ago to this day, there are some difficult days ahead. That saying is no more true right now. There are some difficult days ahead, but we are going to see this through. We are thankful that we are yet able to fight. We're thankful that you're here with us this afternoon, and we're thankful that we have the opportunity to give you the resource information that you need. God bless you all.
Thank you all for joining us this afternoon. My name is OKRIAH. I serve as the Assistant to the Director of Public Engagement at the Office of the Governor, the 75th Governor of North Carolina, Governor Roy Cooper. Governor Cooper, along with Cabinet Secretaries, agency staff, and thousands of state employees, have been working incessantly to fight this pandemic and help the people of North Carolina get through this tumultuous time. This is our 4th weekly webcast with a purpose to have multidimensional information sharing, to make sure we are available, transparent, equitable, and connecting with all North Carolina communities. Today, we will focus on faith, nonprofit, and small business communities. We encourage you to engage with us via the YouTube stream chat or the WebEx stream, where you can submit questions real time. There are epidemiologists standing by to answer health-related questions, as well as government agency professionals to answer any leadership questions you may have. We want to make sure these virtual sessions provide you with as much information as possible. During our program today, we will hear from Mr. Benjamin Money from the North Carolina Department of Health and Human Service. After Mr. Money, we will hear from Ms. Caroline Farmer, the Director of the Office on Volunteerism and Community Service. Next, we will hear from Mr. Thomas STITH, District Director from the United States Small Business Administration. Following Mr. STITH, we will hear from Pastor Mark GIBSON from Redeeming Love Missionary Baptist Church. And finally, we will hear from Jeremy Collins, the Director of Public Engagement, who will address additional concerns submitted today and close our session. Again, I want to thank everyone for being with us today. We want to make sure you have up-to-date information. We also encourage you to visit the North Carolina Department of Health and Human Service website at ncdhhs.gov/coronavirus, where you can find additional resources and information. With that said, I invite Mr. Benjamin Money from the North Carolina Department of Health and Human Service to the stage. Thank you.
Thank you, Kiera. Earlier this week, we were very fortunate to have a collaborative of North Carolina data experts from the private and public sectors that released a specific forecast modeling how COVID-19 could affect our state in the coming months. The model reinforced the need for social distancing to slow the spread of COVID-19 and ensure that our hospitals, our healthcare system is there for the people that need it. The team found that social distancing policies that we currently have in place in North Carolina will help lower the likelihood that we will not overload our healthcare system. We don't want our healthcare system to be overloaded. We want to make sure that the resources are there when people need them. As I've said before, if too many people come into the healthcare delivery system at one time, then that would stretch our capacity to provide the resources that people need. So the thing that they also found was that if we ended social distancing at the end of April, this could lead to a greater than 50% probability that we would outstrip our acute care and intensive care bed capacity, possibly as soon as Memorial Day. They also found that if social distancing was to stop at the end of April, roughly 750,000 North Carolinians could be infected by June 1st, as opposed to 250,000 if some form of effective social distancing remains. As I said before, social distancing flattens the curve so that fewer people get sick at the same time. When people aren't coming in contact with each other, it lowers the chance that they'll catch the virus or pass it on to others. As of this morning, there are 3,426 lab-confirmed cases of COVID-19 in 90 counties, with 386 hospitalizations, and sadly, 90 fatalities. Our prayers go out to the families of those victims. We're seeing hopeful news, however, from other countries that measures to social distance people are actually flattening the growth curve in the transmission of the virus. The governor's statewide stay-at-home order is the best way we can stay safe and limit the spread of COVID-19. While many of us are staying at home, we rely on essential workers to stock and staff our grocery stores, to prepare and deliver our food, to drive and unload delivery trucks. We also count on our doctors, our nurses, our pharmacists, our medical assistants, and others who are on the front lines of caring for those who are sick. One thing they all have in common: if they're parents or caregivers of young children, when they go to work, they need a safe place for their children to be cared for and to be nurtured. A hotline is now available to help essential workers find child care programs that are meeting new health and safety and occupational guidelines in light of COVID. Parents and caregivers can call 888-600-1685 from 8 a.m. to 5 p.m. Monday through Friday. Child care options are available in licensed child care facilities for children's ages infant through age 12. North Carolina Department of Health and Human Services has also established an emergency child care subsidy program for essential workers as defined in the Governor's Executive Order 121. Essential worker emergency child care financial assistance will also be offered through May, and it may even be extended. To receive an emergency child care subsidy, parents must complete the COVID-19 parent application for financial assistance for emergency child care and submit it to their child care provider. Financial aid is available to parents and caregivers who are essential workers and who meet the following criteria. Their income is below 300% of the federal poverty guidelines. They're an essential worker fighting COVID-19 or protecting health and safety of communities. And they feel that they have no other viable child care options available to them. As we face this pandemic, we know that our childhood workforce is essential to supporting our system that allows our essential services to be there for all of us. We will be providing bonuses to all teachers and staff that work in these programs serving essential workers. Child care programs that stay open to serve essential workers will receive $300 per month for each full-time teacher and $200 for each full-time non-teaching staff members, including administrators, janitors, and other support staff. In terms of food and nutrition assistance, if you've already received help buying food through the Food Nutrition Services, or FNS, the North Carolina Department of Health and Human Services has received permission to enhance your benefits through the COVID-19 pandemic. To check on the availability of your benefits, you should call 1-888-622-7328, or you can visit www.ebtedge.com for more information. Also, to limit the spread of COVID-19, DHHS has also received approval to extend food nutrition certification periods so that beneficiaries don't have to visit county social services offices to qualify for continued services. Also, the certification periods will be extended for all 6 and 12-month cases that have a certification period ending between March 31st, 2020 and April 30th. Now, in terms of personal protective equipment and supplies, these supplies, such as face masks, N95 masks, face shields, goggles, gloves, and gowns, have been in short supply as the COVID-19 pandemic rages throughout the world. These are critical protections for healthcare workers serving COVID patients. DHHS and Department of Public Safety have been aggressively contacting manufacturers and suppliers to purchase what's available. If you have PPE or personal protective equipment to sell or donate, please contact vendorhelp.covid19@dhhs.nc.gov. We're accepting those donations and offers to purchase. CDC also, Centers for Disease Control, also released guidelines recently that everyone should wear a face cover when they go out in public. For example, to the grocery store or to pick up other necessities. In fact, my daughter just this weekend made face coverings for all of us. So it's important to remember that you can spread COVID-19 to others even if you don't feel sick. Face coverings are also not the same thing as N95 masks that are needed by our healthcare providers and first responders. Our supplies of face masks need to go first to those on the front lines. Our healthcare workers need that protection. Face coverings, however, should not be placed on young children under age 2, anyone who has trouble breathing, anyone who's unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face cover is meant to protect other people in case you are the one that's infected. These makeshift masks are not meant, as I said before, for healthcare workers, but for the general public. These cloth coverings can play a part in controlling the spread if they are used properly and in combination with other tried and true things like washing your hands, wiping down surfaces, and keeping social distance at a minimum of 6 feet between other people. If used incorrectly, these face coverings can actually expose someone else to more germs rather than less. So it's important to remember how to use these. You can go to the CDC's website. They actually have instructions on how to sew these things at home. Also remember that the best evidence on reducing the spread of COVID-19 is social distancing and staying home. These face masks are not a substitute for that. I want you to also remember that to get the latest information on COVID-19, please visit our webpage at www.ncdhhs.gov. And at this time, I'll call up Ms. Caroline Farmer from the Governor's Volunteerism Office to give us an update on volunteer opportunities for your community. Thank you.
Thank you, Ben. Good afternoon. My name is Caroline Farmer. I'm with the Commission on Volunteerism and Community Service inside the Governor Cooper's office. It's been 4 weeks since Governor Cooper declared a state of emergency. A lot has happened. The weather's changed. I know for myself, we've missed birthdays and religious celebrations. So there's a lot going on that we feel like we've missed. But in response to this, I've seen some beautiful creativity occurring around the state. I would say that the creativity in how to create a community online has been quite a challenge for everyone, and you're succeeding. You know, I've heard just yesterday, you know, as Ben mentioned about the face mask, I heard just yesterday about Craven County, their long-term recovery group, their disaster group, is sewing masks for emergency workers and medical personnel. I heard today about a church youth pastor who is hiding eggs tonight on Saturday night for those in his congregation that were under the age of 5. I've heard how people have been having conference calls with the kids, a video call with the kids, so that they can feel a part of a community even if they're not present with that community. And today, I was talking to a faith pastor about how to help a local community where Meals on Wheels was shutting down because they didn't have any volunteers. So I'm hearing beautiful stories about how people are stepping up just in a little bit different way. And that is wonderful. I would encourage you, if your community has people who can sew, have them sew masks for their neighbors, for medical personnel, for those in a nursing home. As Ben said, there was a shortage of masks and gloves. If you happen to have unused masks and gloves, please take them and donate them at your local DSS or public health office, or even the local emergency management office will be happy to take them and get them in the right hands. And there are always volunteer opportunities posted at volunteernc.org. We try to keep that regularly updated. Every day something new shows up there, and so we want to make sure you know about it. We posted about Corona Community. I mentioned it last week because it was just coming out. And that's where your vulnerable, at-risk population can sign up to have things delivered that they need. They can also sign up for a well check visit from a new friend. So I encourage you to find out more at those websites. Now, as many of you have paid attention to the previous press conference, they just announced about the waiver for non-congregate sheltering. And for those of you who have not been in this emergency world for a while, this is the first time that we've ever had non-congregate shelter payments being allowed. So what does that mean? Well, normally we're sheltering in gymnasiums and civic centers, large populations. We can't do that here. But what if you have someone who needs to be segregated from everybody because there's a concern about COVID? How do we make sure that they have a place to stay? And that's where this non-congregate sheltering comes in. Now, what's nice about it is that we did put the guidance for how this works on our website, on the Volunteer NC website. But how this works is local communities, local counties, we'll work with nonprofits to help shelter, feed those individuals until they are, the quarantine ends. And this is a great segue, actually, to what I talked about last week, which is the public assistance reimbursement program that FEMA is offering. So if you remember, there are some requirements to nonprofits, 501c3s, for you to potentially be reimbursed for your public assistance. So I want to make sure I go through those again. You have to pay attention to an applicant briefing. These are being done live this week, so you can ask questions. They are also going to be videotaped, so you'll be able to go online afterwards. After you do that, then you apply by sending an email to pahotline@ncem.org. So that's public assistance, pahotline@ncem.org. And that's the way you register, and from there they'll send you the grant information. So I just want to make sure, a lot of you know entities that are helping. These are not the common groups that we normally see during a hurricane season or when there's a fire. These are daycares, nursing homes, other nonprofit entities that have stepped up in unusual ways to help out during this epidemic. I want to make sure that they know about this opportunity, because you might be hearing about it and they may be working and not aware of it. So we want to make sure this information gets to them. So if you'll please share it with them as well, that would be great. And for other financial resources related for nonprofits, I would encourage you to check out the North Carolina Center for Nonprofits. They have a link on their page to financial resources for nonprofits. We all know that right now, money's not flowing into a lot of the nonprofits, almost all of them. So it's more important than ever for you to advocate for those folks and make sure that they are getting the necessary funds to continue the good work that they're doing. So keep on being creative, keep on making community, keep on helping others. And on behalf of Governor Roy Cooper, thank you all very much.
Good afternoon. I'm Thomas STITH, the District Director for SBA here in North Carolina, and I appreciate the opportunity to speak this afternoon. SBA is very engaged with the economic recovery of our small businesses throughout North Carolina, but this issue is bigger than just small businesses. While small businesses and nonprofits make up over 900,000 small businesses throughout the state, they employ 1.7 million people as well. So this is not only an economic issue, this is an issue that is impacting our neighbors and our communities throughout North Carolina. SBA has two significant initiatives that are critical at this point in our state's economic recovery. First, the Economic Injury Disaster Loan and its accompanying Economic Injury Emergency Advance was put in place on March the 17th when North Carolina was declared a full disaster. That means that a small business in any of North Carolina's 100 counties became eligible to apply to SBA for Economic Injury Disaster Loan, or EIDL. These loans are in the amount of up to $2 million and payable over a 30-year period at 3.75% interest and 2.75% interest for nonprofits. As an additional benefit to the EIDL loan, there is the opportunity for the applicant to apply for an emergency economic injury advance. This advance can be up to $10,000, and once approved, SBA will issue those funds within 3 days. Your EIDL loan will continue to go through the process, but the important thing to remember is the advance is a grant. This is not required to be repaid by the applicant, regardless of the outcome of their economic injury disaster loan. If they are approved or not approved, this advance will not be needed to be repaid by the applicant. And this is a way to provide initial emergency funding to our small business community. The second significant initiative that was passed by the U.S. Congress on March the 27th is called the Paycheck Protection Program. This initiative is designed for small businesses to receive an incentive to maintain their employees, to keep people working throughout North Carolina. These loans are up to $10 million for a 2-year period at 1% interest. And the key difference is, as a part of this initiative, a portion of this loan can qualify to be forgiven. Therefore, the borrower would not have to repay a portion of the loan. And the incentive is, if that employer, that small business or nonprofit, maintains their payroll during an 8-week period, those funds paid for payroll costs, utility costs, lease payments, mortgage payments, that amount is determined over an 8-week period, and that portion of the loan will be forgivable. And so that's an incentive for that small business or nonprofit. And for both of these loans, the EIDL and the Paycheck Protection Program, we also are eligible for these loans are institutions of the faith community. So it is small business, nonprofits, including the faith community. So these two initiatives have launched. There is a third initiative by SBA for existing SBA loan holders. It is called the Small Business Debt Relief Initiative, and this will be a 6-month payment of principal and interest for existing SBA small business loan recipients. I want to talk a little bit about our resource partners that are helping SBA throughout North Carolina, but first and foremost, please remember, if you are interested as a small business in any of these initiatives, go to sba.gov/coronavirus. That's sba.gov/coronavirus, and it will list all the information and the appropriate links to these initiatives. The economic injury disaster loans, with the part of that will be the request for an advance emergency grant, the Paycheck Protection Program, and also the Small Business Debt Relief Initiative. We have numerous resource partners in addition to SBA that can help directly, obviously virtually through online or a call center, and I will provide that information in a moment. But our resource partners throughout the state are prepared to assist as well. I'm sure many of you are familiar with the Small Business and Technology Development Centers located at our university campuses throughout North Carolina. They are currently working with small business in a virtual environment. The Women's Business Centers throughout North Carolina in Asheville, Charlotte, Durham and Raleigh, and Fayetteville. We have a Veterans Business Center in Fayetteville as well that can help our veterans. So not only is SBA responding with these significant economic support mechanisms, we have our resource partners throughout the state of North Carolina ready, willing, and able to support and help the recovery of small businesses throughout our state. So in closing, I would like to encourage all small businesses within North Carolina. We have over, as I mentioned, over 900,000 small businesses, 1.7 million North Carolinians employed by these small businesses. I encourage small businesses to move forward for the economic injury disaster loan. You would apply direct to SBA through the website, sba.gov/coronavirus. For the Paycheck Protection Program, small businesses would work with their local lender. SBA actually will guarantee those loans, but the small business is working with their local lenders in their own communities to apply for the Paycheck Protection Program. And obviously the Small Business Debt Relief Program is another initiative. So I look forward to talking with North Carolinians across the state as we engage our small business communities and work not only to sustain and revive our economy, but to protect and ensure our communities are strong moving forward. Thank you.
Good afternoon. Governor Cooper, First Lady Cooper, Governor Cooper, your staff, and to my fellow North Carolinians. Thank you so much for this opportunity to come and speak from the faith community on this COVID-19 coronavirus. Many times it's easy for us from our chairs to decide what we would do. But I want to encourage my fellow North Carolinians to let us continue to support our governor, his staff, the North Carolina agencies, as well as our community partners that are doing a wealth of individual and a wealth of collective decisions for all of us. Many times we look at this from as perspective of a personal matter, but our governor has looked at this as what's best for the entire state of North Carolina. While some of us will have our own issues and have our own say about what it is that we should do, let us rally, let us support, and let us continue to pray for the leaders of this state. They're doing a fine job, making tough decisions for many of us, but at the same time, recognizing that we all are one. In 1 Thessalonians, it tells us that we should give honor to our leaders, who not only are our spiritual guides, but also have our personal interest in mind as well. And so I encourage you, ladies and gentlemen, as we move through this pandemic, that we recognize that we're not powerless, even though we may be in some paralyzing times. We still have power to continue to move forward, as North Carolina has always done and always will do. I also want to speak, ladies and gentlemen, from the perspective of the faith community and what we're doing in terms of staying in contact and also staying in touch with our congregations. We're seeing that we're having to be ingenious in what we do, whether it's Facebook Live, Zoom, WebEx, whether we're live streaming. But we're seeing not only the best come out of us, but we're also seeing the ingenuity that we can use through technology. And I would encourage you, as a pastor of a church here in Raleigh, North Carolina, that we continue to follow and lead with the notion of what our governor has told us and shared with us through this pandemic. I know it's easy to want to gather, particularly during this time of the year of Holy Week. I share with you, ladies and gentlemen, that it is even scriptural. In Luke 24, when Jesus told his disciples to stay in place. That's the first shelter in place that we see. And while we understand that there are many opportunities that we can get out to be around one another, particularly during this season, I want to encourage you, ladies and gentlemen, that we not forego what our governor has stated, that we not forego for our own selfish purposes to be out. I know it may be hard. I know that this is unusual to celebrate resurrection and not be together. But even in the resurrection, Jesus asked his disciples to shelter in place until they are endued with power. We have power. We need to stay in place so that when we come through this pandemic, we'll come through even more powerful than we did when we entered into it. My brothers and sisters, while there is social distancing that we must exercise, please understand our scripture also lets us know that there were 10 lepers who were the first case of social distancing. But it was when Jesus came to them, they were all healed, and one was made whole. Be thankful for this time that we are able to reset, to rejuvenate, and also to recoup our rest, our time with our families, and even our time with our Master. I thank you so much. And once again, we invite you to continue to pray for our governor, his staff, and the agencies that are carrying out the awesome job of leading this state with distinction and also with you in mind. God bless you, and heaven smile upon you.
Thank you, Pastor. Thank you all for sticking with us online. Before I close up, I just want to thank everyone who presented information today and all of you who presented questions and concerns online. We were monitoring, we are continuing to monitor. I want to thank OKRIAH Harris from our office, Mr. Benjamin Money from DHHS, Ms. Caroline Farmer from our Commission on Volunteerism and Community Service, Director Thomas STITH from the U.S. SBA, Pastor Mark GIBSON, and again, to you all who asked questions online. I want to address a few things just before we close. First, the question has been asked, why are we inconveniencing, through the governor's executive orders, so many people when statistically so few people are likely to succumb from this illness? I want to answer that in two ways. One is a part of the reason that so few people, we hope, will succumb to this illness is because of the preventative measures that we're putting in place. There are places in this country that have not put the level of preventative measures in place to both flatten the curve and slow the spread, and their numbers look very different from ours. And we are praying for everyone in every corner of the United States and across this globe. But understand this, each one of us in North Carolina is important to Governor Cooper and to this administration. And so if it means an inconvenience to some of us for the better of a few of us, that all of us might be healthy, then I speak for Governor Cooper in saying that's something that we're willing to do. And so we don't intend to just inconvenience you or to curb the things that you would like to do for the fun of it. It's not exciting to us. We want there to be recreation. We want there to be opportunities. We want businesses to thrive. But first and foremost, we have your health and welfare on our shoulders, literally on our hands. And so we have that responsibility, and we don't take it lightly. And so if that means that instead of dining out or going to a bar, you have to do curbside service and fellowship via Zoom or YouTube or FaceTime, then that's just something that we're going to have to sacrifice for a little while. Again, we're not excited about it, but we are conditioned and compelled to take care of every North Carolinian. So that's why we do that. Second thing I want to address is there were a number of folks who said online that they may be missing a piece of information. So I want to, if you're on either YouTube or the teleconference or WebEx, if there's any piece of information that you missed, whether it was a website that was mentioned and you missed what it was, we put this on YouTube so that you can go back and watch it and get the information that you want. The other thing is you are welcome to send me an email at ope@nc.gov. That email address again is ope@nc.gov. You send an email to that address and ask me specifically for what it is that you need, whether it's a resource or a fact sheet or FAQs, or whether or not the SBA applies to churches, which that question was answered. The federal government, as of April 4th, opened up the SBA benefit eligibility for churches and gave guidelines to define a church as an eligible business. So that is good information. When we sent out our mass email on Monday, we included information, a link to the SBA website, so we want to make sure you have that. But if you have any question or if you want something to be forwarded to you, our job is not just to be here to talk in front of the camera. We don't want you to think this is just a press conference. This is literally an opportunity to exchange information and give you the resource information that you need. I do have to shout out and give special recognition to our North Carolina Office for Historically Underutilized Businesses. The hub office here in North Carolina has done a yeoman's job in facilitating the relationship and the continued work with the federal SBA office. So the hub office director, Ms. Tammy Hall, Director Hall, under the leadership of Secretary Michelle Sanders in our Department of Administration, not only monitors and facilitates nonprofits and minority businesses. Historically underutilized businesses include women-owned and minority businesses to interact and engage with the government, but also to be a watchdog, to make sure that there are opportunities for those businesses to contract with government and beyond. And so if you want to learn more about the Hub office, their web address is ncdoa.gov/businesses/hub. That's HUB. Again, that web address is ncdoa.gov/businesses/hub. Finally, I have to, on behalf of Governor Cooper, again, thank you all for being here. Thank you for engaging with us. I'll say this, there are a number of questions that were asked both in WebEx and in YouTube. We set this format up such that you can access the information as you need it, but we don't have to wait until Wednesdays to ask the questions. We're available in our office around the clock. You can send an email to the website, to the email address I mentioned earlier, OPE@nc.gov. You can also visit the governor's website, governor.nc.gov. And at the governor's website, there is a portal where you can submit any request that you have for the governor, or if you would like to give him information or to give our office information about things that can be helpful. I saw folks mentioning things about why are certain businesses essential. And why are certain workers essential versus non-essential? One of the things that we released in our last executive order was that a business could be facially non-essential, but could become an essential business through application, and if they did agree to abide by the social distancing policies. So there is some room there. We do monitor that and reassess it on a daily basis. But that's how those decisions are made. But if you have ideas, we want you to give them to us. Go to the governor's website, governor.nc.gov. And finally, if you'd like to sign up to continue to view this update and have ideas about other things that you'd like to learn about, we also have an engagement page that you can go to, sign up for our engagement page, and then we will give you issue-specific content. So that web address is governor.nc.gov/engagement. You can tell us one of any 20 issues that you want to learn about or stay connected on. What we have heard today, the overwhelming theme to my Muslim brothers and sisters, to my Jewish sisters and brothers, to my Christian brothers and sisters, is that we had a saying when I was growing up that in essentials, unity. In non-essentials, liberty, and in all things, charity. In essentials, unity. In non-essentials, liberty, and all things, charity. And that rings true to me today. We've had to make some tough decisions to set some of our liberties aside for our unity, but the spirit of why we do this is of charity. It's of welfare for all of us. I want us to be reminded that we might be separated from our physical bodies together, but we are never absent from each other, that our physical connection be not broken just because we cannot actually touch. I am excited that we get to share this time together to give you information. We do mourn and send condolences to those who have lost this struggle with the COVID-19 crisis, but we are compelled to continue to work. So we cry and we mourn them and we send love and light to their families. And then we pivot to our community partners and say, this is why we try to slow this spread and we try to flatten this curve. Thank you for being with us today. Thank you for staying with us. Again, if you need any additional information, please reach us at OPE@nc.gov. We plan to be back here next Wednesday at 3:30 with an additional update at that time. But in the meantime, let's keep in touch. And if we can do anything to help you, please let us know. Thank you all.